This is CGTN, China Global Television Network.
Hello and welcome to Headline Buster, brought to you by The Point with me, Liu Xin. In this series, I dissect stories that are making headlines around the world and talk to my guests to compensate for the missing pieces of the puzzle. So join me in real time by sending us your comments or questions via the CGTN page on Twitter, Facebook, YouTube, or Weibo. If you're watching this live on the CGTN application, email me at thepointwithalex@cgtn.com. Let me know what you think. We live stream Headline Buster at 11 a.m. Beijing time on Thursdays and air the segment on TV at 11:30 a.m. on Friday. So do join me during the live streaming and get in touch. I would love to receive and possibly read out your insightful comments and questions, of course. This week, we're looking at reports on the use of traditional Chinese medicine, or TCM for short, in fighting COVID-19. I'm in front of a traditional Chinese medical cabinet and a counter. It's a typical setting in a TCM pharmacy here in China. The little drawers will be containing ingredients that are blended together based on customized prescriptions. So, how are the international media framing the TCM's use within China and beyond, as a viable option or as some kind of placebo effect or even a soft power ploy? As the number of COVID cases reported worldwide tops 500 million, with over 6 million deaths and with outbreaks still flaring up around the world, this topic is timelier than ever. But first, what exactly is TCM? Simply put, it's a natural medicine system that's been used in China for thousands of years, which emphasizes harmony between bodily functions and also harmony between humans and nature. Instead of focusing on killing pathogens, TCM remedies aim to help us maintain or regain our physiological functions so that our immune systems, our bodies, will fend off diseases themselves. TCM also has its ways of killing bacteria or viruses, believe it or not. To block transmission of airborne pathogens such as the one causing COVID-19, we have measures like burning incense, carrying sachets, and setting off firecrackers, which helps clean the air. Now, some herbs used by TCM have been found by modern labs to have antiviral or antibacterial functions. Chinese scientist Tu Youyou won the Nobel Prize in 2015 for her discoveries concerning a novel therapy against malaria, which saved millions of lives. And her inspiration, I should say, comes from a TCM prescription dating back 1600 years. In the European Pharmacopoeia, essentially the Western Bible for the quality control of medicines, the number of records for herbal drugs with an origin in TCM keeps growing. We Chinese have always used TCM to treat plagues in history, and the latest battles were against SARS in 2003 and now COVID-19. It's been part of China's standard guidelines since the outbreak in Wuhan early 2020. After 2 years of trials, a meeting was finally convened this spring by the World Health Organization on the effectiveness of TCM in treating COVID-19. Experts from China joined virtually and shared what they have learned from practices. The meeting acknowledges that TCM is beneficial in treating COVID-19, particularly in mild to moderate cases, and beneficial in reducing the risk of progressing to severe cases. I don't want to be nerdy here about technical details, so if you're interested, you can find the report online, but the conclusion is clear, that TCM is beneficial in fighting COVID-19. Because of clinical effectiveness over the past 2 years, China has shared TCM expertise and sent experts and products around the world to whoever needed them. When I talked on Twitter about this topic, one African user told me in his country, Uganda, people also use traditional medicine because it's helpful and economical. Actually, around 80% of the world's population is estimated to use traditional medicine. The World Health Organization Director General has said, for millions of people around the world, traditional medicine is the first port of call to treat many diseases. Given the lives at stake and time-tested clinical effectiveness, TCM is a natural option for China in its fight against COVID-19. But not everyone seems to agree. Some have framed China's efforts as its latest soft power ploy or tool for competition against the West, while suggesting TCM is useless. It's nothing new, really. Remember the mass diplomacy or vaccine diplomacy? And now it's TCM's turn. Let's look at this particular article, which was published recently. China tries to win global acceptance for traditional COVID cures. The gist of the article is that, and it says, Chinese mixtures are part of President Xi's effort to compete with the West. It says President Xi Jinping wants other countries to give China's herbal cures a chance. His government is promoting TCM to allies worldwide, sending traditional medicine specialists to Cambodia and supporting clinical trials in Pakistan. Both countries are relying heavily on Chinese aid. But as I said, China has sent TCM experts to 29 countries and regions and products to 10 countries and regions and shared expertise with 150 countries and regions. Are they all China's allies? I understand that these countries need the help that China can offer. Previously, it was masks or vaccines. Increasingly, it also involves treatment. And cost is a big factor for many of these countries. Big pharma patent drugs for treating COVID cost between $500 to $700 per 5-day course. How many people in developing countries can afford them? When Western drugs are expensive and likely unavailable, Chinese alternatives can save lives. Is that a bad thing? The article doesn't say so, of course, but implies there's a hidden agenda. It says making TCM globally acceptable as a treatment option for COVID is an important part of Xi's strategy to use the pandemic to alleviate Chinese innovations and inventions, and that China has still not approved widely used vaccines from AstraZeneca and Pfizer, instead developing its own vaccines and making them easily available worldwide. One analyst in Australia is used to underscore these points, saying to advance its soft power goals, China needs locally developed vaccines and treatment, and that this is part of creating a Sino-centered world and a door opener. Now we see the real problem of China's activities from the perspective of such reports. It's not about TCM, but about Western geopolitical and economic interests being threatened by the promotion of TCM. Their logic seems to be, it's okay for big pharma to knock and open doors in China, but not the other way around. Chinese companies have the right to compete in the world on an equal and mutually beneficial basis. How about letting the other countries decide? As we speak, Western medicine, or conventional medicine as they are called, already has a dominant position, covering over 70% of sales in the Chinese drug market alone in 2020. TCM, being part of Chinese cultural heritage, has long been sidelined. What TCM is asking now is not much. It doesn't seek to replace Western medicine. Chinese President Xi said last year that efforts should be made to incorporate TCM and Western medicine as a general principle. In China's latest guidelines for COVID-19, Pfizer's oral antiviral medicine is added side by side with TCM. Now, ask yourself this. If China were to let the coronavirus rip and use Western vaccines and treatment drugs only, what would happen to the world's stock of drugs? What would China be accused of then? Hoarding? Slaughtering the world's population? While discounting China's legitimate activities, the same article, of course, doesn't miss the perpetual question of efficacy of TCM. It says, Researchers in China have published studies purporting to show the efficacy of herbal treatments, and state media frequently quote Xi calling TCM a treasure of the Chinese nation. To support this claim, the article finds an analyst, this time based in the UK, who claims there is no solid evidence that TCM works. But this is lazy journalism. We've already seen a slew of reports doubting TCM, especially since the pandemic began. And here, you're just seeing some examples. The West insists on having scientific explanation as proof that TCM works, but there is a distinction between clinical proof and what they refer to as scientific proof. China has gathered strong evidence from clinical experiences over the past, and compared to most other countries, and especially considering its dense population, China has been able to keep its COVID mortality extremely low. Let's take the figures from 2021 as an example. China registered 15,000 cases of positive or infections of COVID-19 with only 2 deaths. What more powerful numbers do we need to show Chinese methods work? There are people who will say, well, China's numbers are opaque. Let me tell you this, with 1 billion internet users, it's extremely difficult to cover up deaths, even in small amounts. Science is not yet able to fully explain TCM. Is TCM to blame? There's also the issue, of course, of wildlife protection. Although the TCM drugs for COVID are all herbs or natural minerals. And China never said all age-old practices must be kept. President Xi explicitly called for carrying on the fine elements in TCM and innovating them. The use of wild and endangered animal ingredients are being replaced by farmed or artificial ingredients or simply herbs. The proportion of animal drugs included in the latest edition of the Chinese Pharmacopoeia has decreased from 9.5% to 7.8%. A small dip, I admit, but the trend is there. In conclusion, TCM seems to be the latest collateral damage of the China skeptic narrative in the media. I wouldn't be surprised to see more skeptical reportage on TCM in the field in the future, both because of geopolitical and economic interests that are at stake here. Chinese authorities and companies have the right to promote TCM at home and abroad, just like their counterparts with conventional Western drugs. And it's not just about traditional Chinese medicine. The fine elements of traditional medicine worldwide have the right to be preserved and promoted as a helpful and affordable option. The world is diverse, whether we like it or not. We'll take a short break, and I'll be joined by 3 experts from Nigeria and China and talk about this topic in greater details. Stay with me.
Facing the unknown is always difficult. In a world in turmoil, it's easy to lose orientation. But when the storms come, we have to see the possibilities, reinvent, find new opportunities, discover a path forward. CGTN, see the difference.
Making sense of the overwhelming wave of information means cutting through the noise to shine a light on the heart of the story and making room for new perspectives. True understanding means the ability to see events from more than one side. I'm Liu Xin, and this is The Point. Welcome back to Headline Buster, and I'm talking about traditional Chinese medicine, especially in the use for fighting COVID-19. And I'm pleased to be joined on the line by 3 guests. They are Dr. Olajide Olaleye, who is postdoctoral research fellow from the Shanghai Institute of Materia Medica of the Chinese Academy of Sciences. He's joining us from Ibadan, Nigeria. Welcome. We have Dr. Shirley Ox, who is a traditional Chinese medicine doctor doctor. She's joining us from Beijing. She works for the United Family Hospital. And we also have Professor Lin Zhishiu, who is director of Hong Kong Institute of Integrative Medicine from the Chinese University of Hong Kong, joining us from Hong Kong. So the warmest welcome for joining us on this edition of Headline Buster. Dr. Ox, you actually have a very long dedication studying traditional Chinese medicine, but you also have knowledge about Western medicine, and you have actually focused more specifically on the use of traditional Chinese medicine in dealing with COVID-19. What have been your understanding about the use and the importance of incorporating traditional Chinese medicine in the fight against COVID-19?
Well, actually, I am just purely a Chinese medicine doctor. Ironically, the education in Europe and the United States includes only a third of Western medicine, unlike in China where it's half and half. So we're forced to rely upon our tools. Yes, a friend of mine in the field and I chose to transcribe and translate lectures that were given by Zhang Guoli, Tong Xiaoling, the experts, when they were still in Wuhan. They had lectures online for the Chinese medicine community here. And we felt like that was just invaluable information. This was a historical moment because even though Chinese medicine has been used continuously, because medicine in China before Western medicine was Chinese medicine, this was the first time it had been used with the global spotlight on it and with experts who were able to study it. And so, in fact, the studies, it's very unfortunate, as you said, that the media is not highlighting efficacy, either from the point of view of case series or from the point of view of previous related research that has been done. But I've been following this ever since we did our book in 2020, and people have to understand it's very difficult for both logistical and ethical reasons to be doing this sort of clinical trials that are blinded and randomized in the middle of an epidemic. So that hasn't been done. But the retrospective trials do provide solid evidence, and that's what recently came out in the United Nations meeting. So I think certainly media needs to do a better job. We're all working to get the word out. At the same time, government support is a mixed blessing because government institutions tend to be less focused on country-specific transmission. So I think that's where international friends of Chinese medicine come in. And I think sometimes that support can be misconstrued for reasons that really come from both sides. It needs to be presented in ways that are more appealing to people.
I think I know what you're talking about. Let me get back to you on the many interesting points you touched upon, but let me go to Dr. Olalea. There have been people who are saying, okay, traditional Chinese medicine or traditional medicine in general is a good option. You can preserve it, you can promote it, but for acute diseases, for severe ailments, if you only rely on traditional medicine, it could probably kill you, because if you need, if you have a very emergent medical situation, you must get an operation. So what is the use of traditional medicine? What do you say to people to this kind of question?
Oh, thank you. Sorry, excuse me. So as a healthcare professional and as a pharmacist who is interested in drug discovery and development, my focus, I think of it not as, I don't see it as a loyalty game or a loyalty contest. I prefer to, as we've all seen with COVID, wherever the solution is, that's where people will align with. So it's all about solving unmet clinical needs, medical needs generally. So, definitely it has to be evidence-based, and especially regarding safety and efficacy of the medicine. So based on the available evidence, there are a number of Chinese herbal medicines, for instance, that are now manufactured as injectable formulations. So that level of formulation can easily be delivered rapidly into the body and then can elicit effect rapidly as well. some of them that are approved for treatment of critical cases like sepsis.
Let me get some other opinion on this question. Dr. Ox, let me get your viewpoint on that, because this seems to be a bit of a controversy here, because there are a lot of people who are doubting what Dr. Olayeye just talked about, these kind of injections. So there are ongoing debates, right, about how you administer TCM or whether these kind of injections can be useful or helpful or not. Is that your understanding? What is your viewpoint?
You're fading a little bit, but I think I heard your question. Injections are only approved in China. So when you're talking about treating people in the hospital wards or in the ICU, that can really only take place here in China. But my colleagues in Europe and the United States have used herbal medicine, mainly in boiled decoction form or in powdered form, for many patients that had moderate illness, and even sometimes for people that are in the hospital, in which case they're usually taking it privately, so to speak, surreptitiously without the knowledge of the doctors or the hospitals. I think there's plenty of evidence that these remedies are safe. They were used in avian flu, in swine flu, in related diseases before. So I think the concerns about efficacy are quite overblown. And I think that people around the world are finding ways to incorporate them meaningfully into their treatment of COVID. And that will happen more and more.
Dr. Ox, I think, and for the other guests, I think we have to be extremely cautious and warn our viewers that we are not trying to promote a certain kind of drugs or, you know, or the use of any medicine at home without the advice of professionals. I think that is extremely dangerous, and I think we all need to make that clear. But without, you know, without asking people to go and find, what is the importance, basically, I want to say, what is the importance of regulation, Dr. Ox? Because you work in a hospital, and that is extremely important for modern medical treatment. You do have the case of people who claim to have traditional Chinese medical knowledge, but who are actually just interested in money. How is that part regulated?
So it's important to regulate the doctors and to regulate the products. So I definitely support regulation in all countries. We should be making sure that people who claim to the public to be practitioners of Chinese medicine have a rigorous education, have passed some licensing examinations, and there's continuous, you know, professional monitoring of what they do. And many people are not aware of that. They are under the false impression that it's just sort of a set of folk practices. So I think promoting professionalism and Chinese medicine as a profession is important. And then in terms of drugs, I've seen a tremendous shift over the last 20 years. I got my license in 2000, and GMP standards are certainly very common in the herbal industry here and globally. And there's more and more of an emphasis on producing organic herbs, not just using agricultural methods. And when you buy prepared medicines, you can look at any pharmacy here and see the number that's been printed on it because it has been approved and inspected. So those things are very important, and it's important to make people aware of how they are happening.
Professor, Madam, may I just supplement a little bit?
Yes.
Yes, I think a good regulatory framework is very important for the healthy development of Chinese medicine, either in China or maybe in other countries. For example, in Hong Kong here, actually, we have very strict regulatory framework for both TCM practitioners and also the herbal products, particularly for the patent Chinese herbal medicine. So I think the healthy development of TCM in Hong Kong here certainly is helped by the existence of this very healthy, very good regulatory framework ever since 1999.
Okay, thank you very much for that additional information. We have some comments from people viewing us online, following us online. Let's take a look at these comments and see whether we are able to address them. The first one comes from this person by the name of Rushikesh. It says, Chinese medicine have many side effects if consumed with consumed with regular medicines. I guess this person wants to say, talk about the side effects, potential side effects of Chinese medicine. If we look at another comment, I believe we have a second one, which says, TCM uses pangolins, the very animal caused Wuhan virus. Okay, that's a completely different subject. Let's address the side effects first. And Dr. Ox, what is your take on the question about side effects? I mean, Western drugs also have side effects, right?
Right. So first of all, most of the side effects that we see from TCM drugs or decoctions are GI upset, they're gastrointestinal upset. And in fact, there's been a whole body of research on drug interactions. What are the potential interactions between pharmaceutical drugs and Chinese medicine? And actually, the preponderance of evidence shows that if you separate those by half an hour or an hour, with some notable exceptions, for example, blood thinners, we generally don't recommend people take Chinese herbs at all when they're taking certain classes of drugs. But in general, interactions really have not shown to be a great problem because of the different pathways of absorption. Generally speaking, TCM is not interfering or causing greater side effects.
I see. Professor Lin, your take?
Right, and I think all medicines can have a side effect if you don't use properly. That's why we need to have good practitioner to prescribe Chinese herbal medicine. Particularly if you face any sort of pandemic and also very severe type of disease, such as maybe cardiovascular disease, maybe stroke, maybe cancer, etc. To be fair to say, Chinese herbal medicine, in a way, is relatively safer if you really compare to Western medicine. From our experience, because I used to practice in China, and if we really you have to compare two things, I think Chinese herbal medicine, if under a very good hands, it certainly is much safer.
Okay. All right. Finally, yeah, this question about the use of wild animal ingredients or potentially endangered species. The thing about origin of COVID-19, I don't think we need to go there because there's no evidence to prove that. But in terms of use of wild animal ingredients, I've talked about in my monologue that China does not advocate the use of wild and endangered species, and that trend is going to continue. And yet, what more needs to be said? Dr. Ox, what is your take on this question about the use of wild and endangered ingredients?
85% of our materia medica, meaning all of the herbs that are used, all of the substances, plants, minerals, and animals, 85% are plants. Only 15% are animal. And some of those include things like cicada shells or snakeskin that are very sustainably harvested and are not harming the animal in any way. It's very important to realize that rare and endangered species are not being prescribed in regulated hospitals and clinics in mainland China. Now, is that happening in unregulated places? That's a different question. But most of the trade in those kinds of substances is just that, it's trade. It happens around the world. It happens particularly in Southeast Asia. And those are not coming from professional physicians. Those are primarily folk practices. For example, there are a lot of things that are used as aphrodisiacs, as treatments for sexual dysfunction. And those are the kinds of products that do sometimes contain some plants, but particularly animals that are not sustainably raised and are endangered. But in general, the profession is paying a great deal of attention to this issue. So I think it's quite important to separate whether it's trade or whether it's actually happening within the medical industry.
I see. Thanks so much to my guests, Dr. Olajide Olayeye joining us from Nigeria, Dr. Shirley Ox joining us from United Family Hospital, Professor Lin Zhishiu joining us from Chinese University of Hong Kong. I do have to point out we don't have opponents of TCM here on the show, so beware that these have been opinions from the those who are advocating the use of TCM. Just want to be sure and fair on that. And that's it for this edition of Headline Buster, brought to you by The Point with me, Liu Xin. As always, you can follow me on Facebook and Twitter using the handle Liu Xin in Beijing. Your criticism, your feedback is very welcome, as always. On behalf of the team, thanks for watching, and you've got the point.